Hello. On this day where we celebrate Still's initiation of the osteopathic profession on the 22nd of June, 1874, we are pleased to announce our new Postgraduate Diploma course. During this pandemic period, as well as trying our best to provide webinars and conferences, we've been working on our course curriculum, amalgamating our 3 separate courses into a single 18-month course of 3 stages. Our overall aim is to provide an education which enables an osteopath to expand their scope of practice, improve their confidence, and empower them with a refined set of technical skills. There is an emphasis on traditional principles, a unique traditional paradigm of holistic osteopathic healthcare, as well as the relevance and application of mechanical principles. It enables graduate osteopaths to develop new technical skills, to master the body adjustment routine that applies a set of engineering principles to the human body, that enables you to treat and stabilize more complex and traumatized cases, or take a leap into the realm of treating a wider scope of health conditions. As a diploma course that provides you with the membership of the Institute of Classical Osteopathy, the course is taught with a degree of rigor because we are intent on turning out skilled, knowledgeable and competent osteopaths. There are elements of home study, reading materials and some written exercises to ensure you keep up with the course concepts and the knowledge that become the building blocks of your effective mastery. In line with the media age, we also provide inspirational webinars, videos of treatment and other supportive materials. This has been designed to optimize the didactic process, making the in-class experience an active learning process, most effective way of assimilating course contents. A bit of background. In the year 2000, John Wernham initiated a movement to restore the Institute of Classical Osteopathy's postgraduate course that had begun in the 1950s as a quarterly meeting of like-minded osteopaths, keen to maintain the original principles as laid down by A.T. Still and expanded on by the Littlejohn brothers and their colleagues. The Institute's postgraduate course developed in the interim, being integrated in the 1980s and 90s with an undergraduate program led by John Wernham, the president and co-founder of the Institute at the Maidstone College of Osteopathy in the UK. In time, the undergraduate program became a degree course at Nescott in Epsom and separated from the Institute, which is why Mr. Wernham wanted to reinstate the postgraduate education to maintain the original teachings. With his many decades of experience and direct teaching from J.N. Littlejohn, one of the early students of A.T. Still, Mr. Wernham was consulted throughout the early stages of the evolution of what became our foundation and advanced courses, contributing lecture materials and approving the curriculum throughout its development. To master the body adjustment routine that applies a set of engineering principles to the living body, that enables you to treat and stabilize more complex and traumatized cases, or take a leap into the realm of treating a wider scope of health conditions. Since his passing in 2007, in his 100th year, we have worked to continue to develop the course content, structure, and most recently to evolve a curriculum that can be applied in different circumstances, with UK-based groups and with our colleagues overseas, flexible enough to be taught in different surroundings, with online elements to optimize both classroom time as an effective, active learning, minimize the cost of traveling, and our environmental impact. After years of developing separate courses, Foundation, the Applied, or Clinical and Advanced, we have refocused the course direction by amalgamating the 3 courses that we had evolved into one deeper, more comprehensive course of 3 stages. The term classical osteopathy was coined by members of the Institute in the 1990s to apply the same terminology as in other senses of the word classical, such as classical architecture, which could be defined as representing an exemplary standard within a tradition or long-established form, and relating to the first significant period of study. Osteopathy reached its heyday in the early 20th century, when osteopathy represented a whole system of healthcare, incorporating not only an approach to health and disease through a more holistic approach to manual therapy, but also surgery. Although the latter is way beyond our remit, the Institute of Classical Osteopathy maintains the same definition of osteopathy as a system, science, and art of medicine, with its unique approach to hands-on, drugless healing. Mechanical health. Beginning with A.T. Still's mechanical concepts of the human form and its relationship to health, the study of the application of engineering principles to the human body was developed by J.M. Littlejohn, expanded upon and applied and illustrated by J. Wernham and T.E. Their teachings have been explored and expounded upon and taught by the Institute since 1956, when John Wernham published his articles on the lines and polygons of force, the weak points of the spine. We teach these concepts based on sound engineering principles, their application in interpreting and understanding patients' disordered body mechanics, and in treating most efficiently up to a point of stability in the patient and in their improvement. A classically trained osteopath applies the mechanical principles of the lines and polygons of forces, the charts, and the study of the vulnerable mechanical points in the assessment and treatment of their patients. John Wernham exemplified Littlejohn's study of the mechanics and its application in treatment par excellence, with outstanding results in the most difficult of cases, both from a structural and organic perspective. He passed on this knowledge and application to his students, some of whom lead the teaching curriculum of the Institute to this day. Structure-function relationship. One of the most important concepts in classical osteopathy is that of the relationship of the body's structure and its correlation to health. The pioneer osteopaths had established that restriction in the body's soft and articular tissues disrupts circulation, affecting the health of the organs and the nervous system, with many consequences on health. As the osteopathic science evolved, supported by the research of the pioneers, the importance of the physiological interpretation of structure-function relationships became paramount in the understanding and treatment of those suffering from disease. In the course, we gently initiate our students into the knowledge, understanding, and application of the principles of treatment of patients suffering from disease and disorders. There are vital steps in mastering this approach to patient care, including the exploration of a different paradigm of patient-centered disease treatment, with the practitioner simultaneously demonstrating an individualistic, holistic approach to their patients, and a physical and environmental application of treatment through adjustment. From the early days of osteopathy, the practice of technique was actually discouraged. The application of adjustment as treatment was based on essential physiological movements, which osteopathic students were supposed to understand. The approach involved the use of a combination of long lever movements, releasing interrelated tissues in a conjoint action. This was often applied in what became known as the exaggeration technique, where lateral curvatures and distortions were followed or exaggerated, which had the effect of relaxing the tissues, followed by adjustment against the established pattern, which, having been eased through relaxation of the exaggeration, released more easily. Apparently, students of Still's, unable to replicate his treatments of efficacy, developed general and constitutional treatment, working throughout the spine initially, then through the whole body. In many cases, this too was not the most effective method, probably due to over-treatment. Some, however, refined this process to be a highly effective approach to an integrated application. Littlejohn and Wernham, in his stead, evolved the general treatment into a sophisticated routine application with a physiological and applied mechanical basis. Initially referring to the procedure as the general body adjustment, Wernham in due course removed the reference to general as it implied non-specific or ambiguous. The idea of a routine approach to a treatment process and the reference to general give a false impression of a generalized one-size-fits-all regime, which it certainly is not, if applied properly. Although treatment follows a distinct order and direction of movements, its every stage needs to be very specific to the state and needs of the patient's body, with great care and attention. The routine itself is based on key mechanical and physiological principles, which students of our courses are taught to assess and recognize in order to offer an effective, tailor-made application. Students mastering this routine are also encouraged to think outside the box and apply treatment principles in many different circumstances and applications, such as at the bedside, side-lying, and more specifically as needed. Body adjustment, or BA, as a routine is not the same as a general osteopathic treatment, or GOT, which is taught on a different kind of basis, and like general treatment of old, all too frequently over-treats the patient, which can diminish the overall effectiveness of the treatment on a physiological basis. 3 stages of our diploma course. The diploma course has been set up into 3 stages: the foundation, applied, and advanced. It is intended to be run over an 18-month period, although has been intentionally constructed to be scalable and flexible to be taught in different countries with different timescales. There is also a certain amount of flexibility in its delivery, with online and in-person elements, video, literature, and tutorial home study to optimize the learning process, as well as directed study, exercises, continual and final assessment for each stage. The foundation stage begins with the historical context of the Institute and leads the student on a journey of discovery of the approach to osteopathy in line with the early founders of the profession. This stage primarily focuses on philosophy and science of classical osteopathy and introduces the art of body adjustment. It will enable the student to be able to develop an understanding of the application of traditional principles in treatment with a sound basis of applied mechanics, and introduces the student to a physiological basis of treatment of the pioneer osteopaths in a modern context. In terms of practical skills, the foundation stage aims to take a student to a point where they're able to perform the body adjustment treatment appropriate to the patient. This includes practitioner and patient body positioning, physiological movement, lever fulcrum connections, palpation of tendencies and rhythm. The applied stage. This stage evolved from our teaching clinic, which is now closed down due to the pressures of the COVID situation, where our students reinforced and applied the teachings of the foundation course. This course ran through online tutorials on a 2-weekly basis, wherein the student will learn to apply osteopathic thinking in terms of a refined osteopathic diagnosis. It also serves to guide the student into developing skills of communication with peers and patients alike. The process involves developing the skill and habit of clinical reflection, of osteopathic thinking behind their diagnoses. Ultimately, students will refine the application of body adjustment principles in the clinical environment and experience treatment approaches and treatment responses guided by the outcomes of tutorial discussions, reflective log feedback, and monitored through video feedback. The advanced stage. This stage works to consolidate that which has been learned so far and takes it to a deeper level of knowledge and a greater breadth of application. Through analyzing the traditional texts of the early osteopaths, their understanding of applied anatomy and treatment rationales in a contemporary context, with the support of current research, etc., the student will gain the ability to rationalize the treatment principles of the pioneers of the profession. Moving from the basic analysis and simple application of the mechanics from the foundation stage, this stage explores the application of mechanical principles in the recognition of spinal deviation and compromise. The appreciation of general and regional mechanics aid in formulation of integrated osteopathic diagnosis and rationale for treatment of local disruptions in a global causative context. This in turn aids the practitioner in effectively treating and stabilizing the recovery of the patient. At the end of the advanced stage, i.e. the completion of the diploma course, the graduate student should have the ability to practice classical osteopathy independently, being able to formulate treatment plans, interpret and address treatment responses, and have a toolbox of practical knowledge and technical ability. There will be an opportunity to find out any further information and get any specific questions answered in our Meet the Directors Day on the 29th of June. In the meantime, if you want to sign up for courses, go to classicalosteopathy.org foundation course application. We hope to see you there. Thank you.